Good morning, and thanks for waking up to Sunrise at Sea. My name is Kieran Tozo. Today I'm going to be talking to an expert in regards to women issues. And in studio with me is Dr. Ogik Victor. He's a doctor at Kampala Medical Hospital, and he's going to dissect and give us an insight in regards to one of the things so many women actually face, and that's menstrual cycle, or should I say a menstrual disorder. Good morning, doctor.
Good morning, Kira.
How are you?
I'm very fine.
Happy New Year.
Happy New Year to you too.
How is work?
Work is picking up.
Okay.
It's a new year, it's January.
Yes.
But it's picking up.
That's a good thing.
Yes.
Now, today I want us to be talking about menstrual disorder. Yeah,
Okay.
this is something so many women struggle with.
Yes.
And some are aware, some are unaware about that. However, I want you to give us a general understanding of what menstrual
Good.
disorder is. Yeah.
Yes, so I would like to say that one of the commonest reasons that women visit the gynecologist has got to do with their menstruation.
Yes.
Almost 15% of the gynecological consultation is due to menstrual disorders or issues with women and their menstruation. Women hold their menstruation very dear, right from a tender age. They
Yes.
are told that they should see their menses every month,
Yes.
and when it's missed, there is alarm. And it's almost taken as a reflection of a woman's well-being, although not always, but that's how people perceive, or that's how the female population perceives their menstruation. I would like to give a background on menstruation. Menstruation, per se, is the cyclic shedding of the uterine lining that happens once a month or once every month. It's programmed, and a female person will start menstruating when their body is ready to do so. There are so many mechanisms that make this possible. For example, when a woman hits the weight of 47 kilograms, she'll start menstruating.
What?
Yes.
Weight
Weight.
contributes
Exactly.
to when you actually get to a menstrual cycle.
Yes, that's why some girls will menstruate at 9 years, in primary 5, primary 6, and others will start in S2, S1,
yeah.
and it could be due to their weight gain as children. Yes. So it's cyclic and it's programmed by the brain. Yes.
And then when it comes to, given the fact we're actually talking about menstrual disorders,
Yes.
yeah, this leads to so many irregularities, that
Yeah.
tend to happen. So what could be causing that?
The moment a woman does not ovulate due to certain reasons, maybe they have a hormonal imbalance, maybe they're on certain medication, maybe they are very stressed, they are malnourished, they are starving or working out very actively, that will postpone ovulation, and they are likely to miss their menses. So ovulation is tied with menstruation most of the time.
So chances are, if I miss my period, I shouldn't be so worried about it.
Not always.
Not always, if
Yes.
I've been doing everything right.
Yes.
So you say normal and abnormal blood menstrual cycles.
Yes.
So what's normal and
So what's
abnormal?
normal and what's abnormal?
Yes.
Because that's what's going to guide our discussion today.
Yeah.
So the menstrual cycle or menstruation has been defined because of experience of observation of many women over time and over the years. We've come up with averages of what's normal and what's not normal. So the first thing is in the pattern, the regularity. How long is your cycle? You've heard that statement before.
Yes.
And most people say the average cycle is 28 days. The average woman will have a
28.
cycle of 28 days.
Yeah.
But it can be as short as 21 days, and we only allow it to be as high as 37 days before we say it's abnormal. So some people have long cycles that will go up to 37 days. Some people have very short cycles that last only 21 days. So the moment your menstruation, there could be variation from month to month.
Yeah.
For example, in 1 month, your cycle might be 26. In the other month, it might be 31 days. That's an agreeable or physiologic
Different.
variation,
Yeah.
and no need for concern. So if your period is about 2-3 days late once, it's not need for alarm. It's a normal variation.
Okay.
Yes, so that's the pattern and regularity. Some women will go 2 months without seeing their menses. Some might go even 6 months, and there are causes to that we shall look at. The second thing is pain during your menstruation. Some women have very painful menses. We categorize that as, we term that dysmenorrhea. And for some women, it's not painful at all.
So dysmenorrhea is when you have intensive pain?
Yes, very painful menstruation. Anyone who experiences painful menstruation should seek the services of a gynecologist, especially if it's so painful that it distorts their routine. They can't go to work, they can't go to class, they need to take pills, painkillers, lots of them. Then they definitely need an evaluation. That's another form of a menstrual disorder. The third one is how heavy your menstruation is. We know that some patients have heavy flows, so heavy bleeding has really got to do with the person. Whenever a woman comes into my office and says, I think my period is heavy, I have to take her word for it, because it's really dependent on that person's perception of what their normal period is.
Yeah.
So the moment, me as a doctor, I will ask a few questions. Is your pad leaking? Are you leaking? Do you have to burn through about 3 packs of sanitary pads in a day?
For a day,
yeah. You know, changing more than 2 pads, 3 pads in an hour. Those are my cues on categorizing if the period is heavy.
Yes, you talked of having severe pain, those who actually go through severe pain and heavy flow. What could be the leading cause of this, and what are some of the risks that somebody going through this is actually prone to? Yes,
there are about 2 common causes that we encounter. Maybe I'll start with the first, not very common, but can be. There could be a bleeding disorder.
A bleeding disorder?
Yes, that might be diagnosed when a girl hits her teenage years. And before that, they might never have known that they had a bleeding disorder. So when they go into their period, they bleed very heavily. The other is, there are certain things that come up in a woman's life, some other gynecological disorders like fibroids. And that's one reason why someone needs to go to the clinic or to the gynecologist if they experience severe pain. They might have developed fibroids. Fibroids are commonly known now because of the awareness that's going on about them, but that can be one of the causes. It can cause heavy bleeding, painful bleeding. There are other conditions like endometriosis. Endometriosis is another broad topic that has also gained attention of late because of awareness now, and many women are going through it and we need to tell them about it. So endometriosis is one of them. And then rarely of a woman in her 40s or 4th decade of life is adenomyosis. It would be really beyond the scope of this discussion to dissect those causes, but those are some of the causes of painful and heavy menstruation.
Yeah. What are some of the risks somebody going through this may actually be facing? Someone who has constant pain, you have to get painkillers all the time. You have to be.
For some people, incidentally, it's primary. We call it primary disorder. That's nature of what they are going through. I mean, by virtue of their creation, it's painful and it's heavy. There's no underlying cause. For the other risks would be maybe not having a child, and then you might develop the fibroids or delay to conceive. There's also a genetic risk for a number of these issues that could predispose one to get them. There are certain lifestyle habits like smoking that have been linked to some of these disorders like fibroids and adenomyosis. So smoking is one of the things that we might look out for in your history if we suspect you have these disorders.
Okay.
Yes.
What are some of, who do you think are some of the people usually prone to issues, for instance, having constant, fibroids, I should say?
Yes.
You actually talked of endometriosis as being one of the chronic diseases.
Yes.
Many, sorry, not Ugandans.
Yeah.
Many people are actually now facing,
Yeah.
What age bracket are we looking at?
So endometriosis would start or manifest in someone's mid-20s. Yes, mid-20s to early 30s. That's when someone might come down with those symptoms, and then we would suspect. So it's also one of the things that's not commonly diagnosed, or many people, it's more common than we know, because it's not easy to diagnose. It's really about suspicion. And for patients who have, for example, very painful periods that are disabling, we normally do what we call diagnostic laparoscopy, where we have some camera pods that we look into the pelvis of this patient and try to diagnose why their periods are very heavy. And are very painful. Yes.
Any closing remarks for someone that is actually watching you today?
Yeah, so for the disorders that we've described, one thing is, if you are going through something like this, don't stay home, don't keep quiet. Please seek the services of a gynecologist. They can be able to help you, they can be able to improve your quality of life. Your menstrual disorder should not rule your life.
Well, thank you very much, Dr. Victor. Well, it's been a pleasure having this discussion in regards to menstrual disorder. And like you said, keep track of your cycle, eat right, avoid prescription off the desk, or should I say off the shelf. Yeah, talk to someone if you're going through something. Don't keep quiet, because if you keep quiet, chances are you're raising risks of actually this getting worse. Well, that's all I had for you here on the wellness segment. Till next time, good morning.